In this video, together with Dr. Kathleen Kendall-Tackett, we discuss the adverse experiences of childhood, potential traumatic events that could happen during the childhood, such as neglect or abuse, and we also discuss how we, as current parents, could reparent ourselves so we can have a capacity to create these safe environments and different experiences for our children.
Okay, so adverse childhood experiences, first of all, are really common. They're like, I think the current rate in the US is 69%, have experienced at least one type. So, I mean, it was 50 and now they've kind of bumped it up to 69. So it's common. And I remember actually when I was in Greece, I looked it up and it was even at a higher rate there, so there, and again, like I said, I was just saying that to say, look, you're going to run into this, the mothers you work with, you're going to run into this. So I want people to kind of understand that your past does not have to define your future. I think that that's really important. That what you experienced as a child, you do not need to pass on to your children. And some of the common sequelae of that are, depression, anxiety, post-traumatic stress disorder. Those are the big ones. Chronic pain is another one. Okay. But here's the thing. Breastfeeding actually helps mothers cope with the stresses of new motherhood, because remember what it's doing, it's turning down that stress response. Okay. And if you combine the study I had with the sexual assault survivors and how it was turning down their trauma symptoms, okay, it didn't get rid of them, but it turned them way down, because physiologically that makes sense that it would do that. But then Lane Strathern, a researcher at Baylor University, now he did this in Australia, he's originally from there, 15-year longitudinal study. Okay, and it looked at, I think there was 17,000 mothers. And then they found over that period, 500 had been actually referred to child protection. But what they found is if the mothers were breastfeeding, and it did, in this case, not even exclusive, they didn't specify, it was just breastfeeding, they were 3.8 times less likely to neglect their children and 2.6 times less likely to physically abuse them. So you want to talk about a way to break the cycle? That's it. Okay, but here's the thing. If you've got somebody who has a background, of trauma, we want to make sure they don't have any of the symptoms of trauma. So anxiety, depression, and PTSD, we want to make sure that there's some treatment there, because that's one of the things that will influence whether they breastfeed. Okay, so again, I said it's what we call the sequela of trauma, or the effects of trauma. Okay, so if we can, identify and treat those things, or at least get support for the moms in those things, she can break the cycle. And it's like, I remember I was speaking at a WIC conference. That's our ones with our peer supporters, that help the low-income moms. And this woman came up and she told me this story. She told me her story. And it was an amazing story. I mean, she said that she was sexually assaulted for the first time at the age of 3. Assaulted multiple times, throughout her childhood. Actually became a sex worker. And then she eventually found herself pregnant. Now, in most cases, we would consider that to be, a story with a potentially tragic ending. That we would expect to see that continuation. But somebody taught her to breastfeed. And she said it changed everything. I mean, this was her story she was telling me. So, this is one I'm not making up. She said it changed everything. She got completely out of the field. She got completely clean, off of all the drugs and everything. And it changed everything for her. And she said now she's actually, she's a IBCLC and she's working with moms in the peer counseling program. It is an amazing and miraculous story. And again, like I said, I'm not trying to be kind of like overly optimistic here and everything's sunny and roses. But I thought that was a striking example because, she had experienced severe abuse. And this one thing made this big difference for her. It was the turning point. No, I'm sure that there was other support and counseling that happened along the way. But I mean, yeah, it turned her life upside down. So, I want to say to anybody who's experienced adverse childhood experiences, you do not have to repeat the past. And in fact, that can be the stories that you have. Actually, it can be the thing that can let you help other people. But it, doesn't mean that you're going to repeat the same mistakes that your parents or whoever was in that circle that hurt you. You don't have to repeat that. You can actually start fresh. This is what I always kind of tell when I, speak at parent conferences. I say, the story starts new now. Okay, forget all the stuff in the past. And again, like I said, this is part of your story. And kind of at a certain point, there's always going to be some vulnerability, but you can overcome this. I don't think I could be in trauma work as long as I've been if I didn't actually firmly believe that trauma is something you can recover from. And what we're talking about here with breastfeeding, and we're talking about, the kind of, attachment parenting type of approach, that changes the picture. That's something that I found a lot, when I've been a Lactation leader for like 30 years. And it's like, going around to different conferences and stuff, and people would say, oh, I'm probably the only one here, but I'm a sexual abuse survivor. And it's like, first of all, you're definitely not the only one here. That there's loads and loads. And I think what really kind of happens is a lot of people come to organizations like League, like attachment parenting, because they want to do it better. They want a different model.
Yeah.
Okay. And so it is quite possible to overcome this.
Yeah, I agree. That's definitely, a lot of, I can see a lot of, as you said, like a lot of doulas, for example, the women who had really negative experience, and then they just, embark on the journey and help other women to have better, much better experiences. And, teach their daughters about this, and so they could have different experiences themselves.
Right.
Yeah.
And it doesn't mean that, that negates your traumatic experience. Yeah. There's this thing in the literature called post-traumatic growth. And that's different than resilience. Resilience is that you don't kind of have the effects of it. You can kind of go through difficult events and you kind of come out, really kind of okay on the other side. Post-traumatic growth means, a lot of times you have trauma symptoms. You really experience this, but on the other end, you come out a different person, a better person in a lot of ways. And people talk about, their relationships are better. They appreciate things more. Their spirituality and relationship with God has gotten stronger. I mean, so these are kinds of things that even though this was traumatic and you experienced trauma, you can actually have this growth. And I think that that's where kind of reaching out and trying to kind of help other people a lot of times happens, because you want to try to change the picture. Maybe you're going in a position where you're just looking at money and, things and everything like that. And suddenly you realize, no, relationships, are important. I want to see if I can change things and make things better for other people. So I would consider that an example of post-traumatic growth.